Hey there, y'all.
Hey there, guys. I'm Stuffy Stuff, and this is Bobby, and we're reporting from Dallas, Texas today.
That's right. We are between two
It's
teeth.
105 degrees, but it's a nice 62 inside.
That's right. That's right. It is. It looks like you just came off the hockey rink, of course.
Yes,
Do you know
I did.
what? Do you know what we're talking about?
I know what we're talking about, but I'd like to take a minute and before we get into what we're talking about here.
Okay. Because we're talking about a serious thing.
We're talking about a serious thing, ergo the strategic pause. And so I just want to set the scene, set the mood here. We're talking about the regulatory environment.
You were supposed to say.
Dun.
You were supposed to say, "Give me an R," and I was gonna come
Yeah,
through.
but the moment just passed.
No, so they've turned it off now. But it's
No.
we're gonna have
Not at
a
all.
really important, interesting discussion. You got your hockey drip
I'm
going on
also
there. You
signing
just-
with a Division I team called
Yeah.
the Thunder Buddies.
Yeah, that's right. You think they'd sign you on? I bet they would.
You know,
I bet
they
would.
did.
Oh, they did.
Yeah, I'm
Listen,
sponsored
let's
athlete,
get right into it.
living the
We're
dream right
talking
now.
about mental health issues. We're talking about protecting health and saving lives. Basically, caring for our caregivers. You're a new doc. I'm not a new doc. I'm in the regulatory arena. And part of the push has been people like me, regulators, the data shows we get in the way of people getting help they need for mental health and including substance abuse issues.
I asked this question last night when we were around a lot of dentists, actually. And the question was, when you were going to dental school, was it reasonable to kind of ask, how are you doing really?
We like that question because everyone says, "How you doing?" "Oh, I'm great."
Well, no, that's the question.
I know.
Like when
Then
you
you-
went to dental school, was that a thing?
No, not at all.
When I went to dental school, even though it wasn't like really outspoken, it was starting to become like a, hey, are you okay? Are you doing all right? And it was becoming less stigmatized to talk about well-being and mental health awareness.
So times have changed. I think what COVID did was take a tricky situation and just blow things up. And so there's a big push for, especially first responders who really had to deal with things during certainly the initial phases of the COVID pandemic,
Yeah.
and destigmatizing people asking questions like you're talking about, but also just seeking care. There's this great organization called the Dr. Lorna Breen Heroes Foundation, and she was an ER physician that was at the forefront of things during the pandemic in New York. She was an ER physician. She had no prior history of issues with mental health issues. She contracted COVID. She was overburdened, overworked, just basically became paralyzed, and she was afraid to get help because of regulators. She was afraid of losing her medical license. She was afraid of credentialing committees kind of poking into history. And
Of course she was.
she had no known history of challenges, and she died by suicide. And her relatives looked at this situation and said, "We've got to do something. We don't want her death to have no positive outcome." So they started this foundation, and it's actually been very helpful. Once again, I'm the chair of licensing on the Texas State Board of Dental Examiners. We just went through a fairly lengthy process, and it was to change how we ask questions. We used to have questions. We used to have you ever questions. Have you ever had a significant issue with mental health issues? Have you ever had a issue with alcohol? Have you ever had a question or an issue with drugs? And all the data supports when you ask that question, you call these, what do you call these questions?
I call them chump questions, and I have other questions based on what you're saying.
Right.
I know you're in the middle of a spiel, but
yeah, well, that's what I do.
it's an interaction and a dialogue.
By asking those questions, people don't answer them, and it prevents people from getting the help they need.
I would agree, and this is a debatable topic. There's a ton of so I am a wellness ambassador for the American Dental Association, and one thing we talk about is access points. The state board with licensing is absolutely an access point, but there are other access points as well. And I know you're speaking on the access point from the state board side of things, trying to destigmatize getting help. and not mean, that not have that translate to mean you're going to lose your license.
And I think for my state board regulator friends and colleagues out there, we're so reactive in nature. We often end up dealing with things once they've happened. And what I like about this issue and the American Dental Association, you and I are going to be participating in a wellness summit where they're getting together people from the American Medical Association, people throughout the state board environment, people like yourself who is a wellness ambassador. We've got the Federation of State Medical Boards. We've got the Dental Board Organization. And just people coming together and say, how do we help solve this problem in dentistry?
What do you want dental students, new dentists, and experienced dentists to know about the regulatory environment and how it's changing?
I think our medical colleagues are much further ahead on this, and I'm hoping we started something here in Texas and a couple other states to make some change happen. We want to get out of the way of people seeking the help that they need to get. And I guess to back it up even further, just to say, hey, let's destigmatize people talking about it. If you need help, you really need to get it. From a regulatory standpoint, it becomes a patient safety issue because if you're not a safe practitioner, a physician, a nurse, a dentist, then that's not going to be safe for patients. So we all have something to win here.
Yes, and on the note of getting help, I think it's a normal thing to have certain levels of anxiety, depression, having any kind of negativity sometimes comes along with growing up and becoming who you are or who you meant to be.
And you and I have talked a lot about that on recent episodes too.
Right. And so all of that is good. It's just one of the analogies I use when I'm talking to people is it's okay to take a dive and get to the depths of despair, but make sure you come up for air or make sure you're around people that bring you up to the surface.
And
because it's not good to stay there.
Totally agree. Anxiety is a normal part of life. That was one of the episodes we did before about screening tools and whether if you screen too heavily or the wrong people are screening, that can be a bit of a challenge. Sadness, being unhappy, that's a normal part of life, but it can spin out of control.
And not to mention the separate issues, mental health issues that men and women have. And I think this is something that is very distinct to a male versus a female, is that they have different issues based on their emotional capacities.
Right. And I know the American Dental Association, for instance, just had a webinar pretty recently about postpartum depression and things that can be problematic and challenging and just the nuances involved in that.
As a new dentist, I'm excited to hear that the state board is making strides to try to destigmatize health and well-being, or health and well-being, getting help for any kind of mental health issues.
Yeah, part of it is having that discussion. I know with what we try to do with Between Two Teeth, we're trying to figure things out just like everybody else is. I don't have the answers. I don't have the questions, let alone the answers most of the time.
I didn't realize that burnout was a thing. I was raised in a family where that doesn't exist. Like you don't get
toughen up.
Yeah, so I was raised in a family where you don't get burnt out. You just deal with it.
Deal with it.
And that's scary to just deal with it because everyone's going to deal with it differently. You're rolling the social dice, so to speak. And I think a nice thing is you mentioned the state board tends to be reactionary in nature, but trying to be proactive. Where can you go to get really good proactive help? And it starts with you, and it starts with the people you choose to be around. Sometimes your family or your spouse isn't always a great place to start with that. It doesn't mean that you can't find those good positive vibes with your significant others, but just recognize who you need to kind of be with you on that mental health journey, because not every family is ready for that.
I would agree. And you get online, there's all kinds of resources that you can get out there.
And yeah, and it's crazy that someone has to kind of go through suicide, for instance, for everyone to notice. To me, that's the real disparity. That's the tough part. We shouldn't have to reach a therapeutic endpoint. It's kind of like if you have diabetes, you don't have to have end-stage renal disease. we can,
Yeah.
we can get there before.
Well, and so, Steph, that's actually a really good point because mental health issues is a continuum, and that's part of the problem when regulators like me, when you ask a question, there's this big gray area. And a couple of years ago, it was actually 2018, through the Federation of State Medical Boards and some other groups in the AMA kind of got together to try to figure out what's an appropriate thing on licensure things. Either don't ask a question at all, or ask a question, and the question verbiage, and this is what we ended up doing in Texas: are you currently suffering from any condition for which you are not being appropriately treated that impairs your judgment or would otherwise adversely affect your ability to practice dentistry in a competent, ethical, and professional manner? Basically, it just says, hey, if you are not safe right now to treat patients, you shouldn't be treating patients, and we need you to get the care that you need to get. And you got to put the oxygen on yourself first, and that's your professional responsibility.
I hear you. And, from my perspective, I try to tell dental students, especially as a wellness ambassador, I try to tell them that it's not normal to drink every night.
Yeah.
And it's not normal not to at least go for a walk or see the sunshine.
Yeah.
And unfortunately, when you go through dental or medical school or farm school, PA, whatever it is, nursing, what happens is you normalize some pretty maladaptive behaviors.
That's a really good point, and that's actually what I brought up in our licensing meetings. Was we have great data specific to dental students that they're actually drinking more than college students.
If you had a very honest exit interview from each professional student as they graduated, and you had some way to have like a non-punitive method to show, okay, how many drinks did you have when you started dental school a week versus when you ended, or what was the the drug and alcohol intake?
This was actually it was a self-report survey, but it was through the American Student Dental Association, and it really had a fair number of respondents. But it's a challenge, and I'm glad you brought that up, because you got to look at it and say, take care of yourself. What's helping you? What's hurting you?
And I agree with you on that. And part of the
thanks.
reason it's a chump question when I was getting back to that on the state board is I remember what it's like still filling out my dental license. And it's a chump question because you just went through the most insane 4 years of your life. You survived. Yeah. Now, true, there are people that thrive in that environment. But
I loved it.
There's a lot of people there that they're the first in family.
Yeah.
I didn't come from like a crazy, connected family of physicians or dentists. A
lot of financial pressure, lots of just
financial
workload
pressure. There are
pressure.
questions that you have to answer about what are you going to do for work when you get out. It's the first time that you're going to be out in the world without a plan.
A lot of pressures. And from my perspective, when you sit down to do that initial licensure application, or for people in hospitals, the credentialing application through the hospital, or your renewal, you're asked questions, and that's on your mind. That prevents you from doing certain things.
Yeah, it's definitely on your mind. And another point on this, as we're just kind of thinking out loud, is coping mechanisms have a social function to them too. And so
what do you mean?
So there's this whole, I was reading some philosophical
we're kind of getting big into philosophy.
Article on the use of alcohol in different civilizations in history, and the good and the bad. And there have been examples in history where social drinking was considered a good thing. Now, there wasn't like mixers in it. It was like pure, it was pure grain alcohol, but it's a very small dose. And it was only in a social situation. People didn't go home and isolate themselves and drink. And I've been to those dental school parties, those boat parties. It is hard not to feel included and not pick up a drink. It is super tough, especially when your parents cope that way too.
So I think for you and I both, on our own journey of well-being, we've looked at it and said, or at least I can speak for myself, there's really no non-toxic dosage of alcohol. It's not that we don't drink alcohol, but I think we've both been really mindful of it.
Yeah, I'm not hating on alcohol. Yeah. I think it's great in a social environment for
we
some
both
things.
play in beer league hockey teams.
Yeah,
you literally
it's
just
fantastic.
came from a hockey game.
And my point for new dentists when they get out is you're try to make graduation the first step in a new behavioral
deal.
pattern.
Yeah.
Because life gets harder than dental school.
Yep. Yeah. Surprise.
Yeah, surprise.
Surprise, new dentist. No, you're not wrong about that. And I think looking at the wellness levers of sleep and nutrition and exercise and substances like drugs and alcohol, all those things come into play. Life is not easy at times. That's why we want you to join our journey, quite frankly. And once again, we don't have the answers. We like to take adventures. We like to see things and kind of dissect and dive into information to figure out what's going to make sense.
I want new dentists to know that there are people like you on the state board who are trying to at least destigmatize, because the state board represents the public at the end of the day.
We are here to protect the public.
And I think there are people on the state board that recognize that when you help the dentists, you're helping the public.
Yeah. And I guess that's my push for people in the regulatory environment. If we keep stigmatizing people getting the help they need, then we're kidding ourselves. People aren't answering the questions appropriately, and we're preventing them from getting help. So, well, I love that advice. What else do you have to give for new docs out there?
I want new docs to know that you've got to figure out your own path in life, and it doesn't have to be what everybody did in dental school. If your path is doing a lot of CE right when you get out, great. If your path is just surviving, taking a beat, say you travel like crazy.
Take a beat. You travel a lot.
Yeah, that's okay and super cool. And by the way, you can do everything you want and travel.
Yeah.
There's an article in the Wall Street Journal today talking about reverse retirement and
I saw
normalizing
that.
reverse retirement. And it's a European approach to life, and
Yeah.
it talks about taking trips in the middle of your lucrative years.
Yeah.
And man, there is just the pie gets bigger. You're gonna have plenty of money at the end of the day. You got to figure out you can't take it with you.
And we did an episode on being intentional on how you recharge.
Mm-hmm.
And it was a Harvard Business Review article, I think, that looked at the data. When you do take a break, and we've been known to take some breaks. We're getting ready to climb Machu Picchu, Inca Trail. Hopefully I do well with that, but we're going to be gone for 2 weeks. We're going to come back, hopefully recharged.
I've been impressed by how much our patients love it. They connect with it. They connect with our Ukraine mission trip. They've connected with our Guatemala mission trips. It is like when I go to Texas Mission of Mercy, they love that.
Yeah.
And there's something where we stop becoming kind of, just strictly doctor-patient. It becomes a family. Mm-hmm. And we have family experiences that everyone shares in. We have patients that want to contribute.
Yeah. And we have fun with it. We make, you actually design these really cool shirts, and we have staff are wearing the shirts. I wear those shirts all the time from the Ukraine mission trip because I just love how they feel. But it lets people, and frankly, part of why we do that, part of why we do this is to push you guys. Get out there. Get out there and do something. We're getting ready. We're actually doing Thailand through, what is it?
It's the AHI, which is the travel program, through Adabai, which is one of the perks of being a member of the ADA.
Of the American Dental Association. So if you want to join us in Thailand in sometime in November, we're doing that too.
Yes.
We're not going to pay your way, but you can figure out how to get there, and you'll see us, and we'll go, hey, how's it going? We're between two teeth.
And if you have anything that you're always able to DM us and just try to figure out.
We want to hear.
What do you need?
Yeah, we want to hear what you want us to talk about. So once again, thank you for joining us. This is a serious discussion. I appreciate what's happening. I am so looking forward to the American Dental Association Wellness Summit that is coming up in September. It's September 8th or 9th.
There's a lot of...
we leave the next day to Peru.
There's a lot of important people that are going to be at this.
Seriously,
I'm impressed by the guest list.
There's a lot. The Federation of State Medical Boards will be present. The American Medical Association representatives will be present. A plethora of people within the dental realm of things. I think we're going to show up in our satin jackets, aren't we?
I think that's appropriate.
I'm still a little bit nervous because I'm going to be on a panel discussion. I'll be the only one in satin.
You know, one of the takeaways here is Bobby and I, we love talking about well-being. That's why we started this. And the cool thing is both of us have very unique journeys of well-being, and we've had unique challenges. And so that's the cool thing, is finding someone that you can relate to.
Yeah.
And if you find that you can relate to either of us, we're here to help with open arms.
And if we come across as though we have all the answers and have it all figured out,
We do.
we don't at all. At all. But that's part of the fun. That's part of the journey of life. You just hurt yourself, hockey player. You know what?
Oh my God,
That's the
my
universe.
muscle is
That's the
involuting
universe.
right now.
Yeah, that's the universe giving you what you need. Anyways, guys, thanks
played
again
like
for
2
joining
games
us.
today.
We love that you're with us here on this journey, and live your journey. And if you like what we're talking about, please hit the subscribe. Bye.